Dr. Umar from Homeocare International. Osteoarthritis. Osteoarthritis is a age-related degenerative disorder. Generally, osteoarthritis is seen in our knee joints. What happens is, as age progresses, there is a lot of wear and tear in our joints. There can be even calcium deficiency, vitamin D deficiency, which can lead to this kind of a degenerative condition. Generally, the knee joint is formed by 2-3 bones. See, in between these bones there is a cartilage. In between the cartilage there is a synovial fluid. If at all, if the synovial fluid or the cartilage gets degenerated, then we develop this condition called osteoarthritis. Osteoarthritis is generally of two types. It is a primary osteoarthritis and secondary osteoarthritis. In primary osteoarthritis, it is generally a age-related disorder where after 45-50 years there can be a wear and tear in our body, or in females after 45-50 years when they have attained menopause, there can be a lot of calcium deficiency. When there is a lot of calcium deficiency, calcium is also required for other functions in our body. So calcium is stored in our bones. So once the calcium is being absorbed from the bones in the bloodstream, the bones can become weak. So this is known as osteoporosis. So if this osteoporosis is also neglected, it can lead to osteoarthritis. Secondly, I said about secondary osteoarthritis. Secondary osteoarthritis is commonly seen in younger individuals. So if at all, if there is a fracture or if there is an injury, and if this injury is not treated properly, or if there is a discongruous bone, then this osteoarthritis develops in younger individuals also. The signs and symptoms of osteoarthritis are, it starts with a dull aching pain. This pain can be observed during the night when we are taking rest, and this period can continue for 6 to 8 months. Then over a period of time, this pain gradually increases. This dull pain can become a continuous agonizing pain. It can cause a lot of discomfort. We can feel the pain when we are walking, when we are climbing the stairs or getting down the stairs. This pain can increase. With the pain, there can be a lot of swelling around the knee joint. Generally, this osteoarthritis is monoarthritis. It means it starts only in one knee, generally a right or left knee, but over a period of time, because of our habits. For example, if it starts in the right knee, generally when we are standing or when we are using our legs, when we are walking or climbing the stairs, generally we don't use the affected knee joint. We start using the other healthy knee. Say for example, if the right knee is affected when we are standing, we tend to put the pressure or body weight on the left knee. Because of this overuse or over exertion, the left knee can also develop osteoarthritis. So in this sense, generally it starts from a particular joint, then it spreads to the other joint because of our habit, and then when this increases, there we can see a kind of a sound, a click sound when we are walking, when we are climbing down the stairs, getting up, or sitting down when we are squatting. We develop a click sound that is known as crepitus. So if at all this crepitus is there, it is very much conclusive of osteoarthritis. So in this sense, the pain can start from a dull aching pain to a continuous pain with swelling around the knee joint. So if at all, if we neglect this condition also, the pain becomes more severe even during night. Even during when we are taking rest, the pain can be severe. It can be shooting type of a pain. Whenever we are trying to turn in the bed, if the knee joint touches the other knee joint also, there can be severe pain. So in this sense, we can see varied symptoms of osteoarthritis. Generally, this osteoarthritis is a progressive disorder, in the sense when it starts, it can start with only a crepitus. There cannot be much pain, only a sound, a click sound when we are moving about. But when we start neglecting this, or as there is wear and tear, this pain gradually increases, and we can also see a deformity where when we stand straightly, our knee joint is absolutely straight. If at all, if this osteoarthritis is neglected, it can lead to genu varum or genu valgus, where the knee can bend outward or the knee can bend inward. So if this happens, there will be a lot of disability where we cannot walk properly, we cannot squat, we cannot sit down, or totally our body posture will change. This is also a possibility if at all we neglect osteoarthritis. To identify osteoarthritis is very important. Generally, I said it is an age related disorder where after 45-50 years this osteoarthritis can be seen, but there are few things. For example, if there is this crepitus is seen, it needs to be evaluated. So simple things like X-ray can definitely help us out with that. Following a good healthy lifestyle or taking a lot of calcium supplements will definitely help us. So a good healthy food style like taking milk or taking eggs, taking soya beans, taking dates can give us a lot of good calcium. With that, exposing our hands and legs to the sun rays will give us vitamin D, which is very essential. In homeopathy, we use a medicine called a constitutional therapy. So this constitutional therapy is not a painkiller, it is not a steroid. We try to analyze why this osteoarthritis is occurring. It is an age related disorder, or if it is an autoimmune disorder, or if it is a familial history, or various reasons. We see what is happening as a whole. We try to take the symptoms in a whole, we form a totality, and with this totality we give a medicine that is called as constitutional therapy. In Homeocare International, we give this constitutional therapy. So once we administer this constitutional therapy, the signs and symptoms gradually will suffice. With that, we prescribe a diet and we prescribe some exercise which we follow this. Then definitely this osteoarthritis can be controlled without any side effects. We can even avoid the knee replacement surgery. We can avoid the surgery as well if we follow certain this constitutional therapy precisely. Then definitely we can get rid of this osteoarthritis. Generally, when we give this constitutional therapy, whatever the changes has happened in the knee joint, for example, if the synovial fluid is less or the cartilage is degenerated, by giving this constitutional therapy, this cartilage will get regenerated or the synovial fluid will start improving. With this kind, then definitely without any side effects, we can have a permanent solution for this osteoarthritis crippling diseases in the younger and in the old age. But very important, we need to also maintain our weight, because knee joint is a weight bearing joint. As soon as we stand, our body weight tends to fall on the knee joint. So we need to maintain our height and weight. So if we have a good lifestyle, a good diet with a correct constitutional therapy, then definitely this osteoarthritis can be corrected. So coming to the exercise, a simple walk every day around 35 minutes to 45 minutes walk will definitely help us out in treating with osteoarthritis. So osteoarthritis can be treated just by taking painkillers. There is not a permanent solution. If you take painkillers, only the symptom, the pain will come down, whereas the progression, the disease progression cannot be arrested. With a constitutional therapy in Homeocare International, not only we arrest the pain, but we can completely cure or arrest the progression of osteoarthritis, preventing its complications also. So Homeocare International, with a constitutional therapy, we have effective treatment for osteoarthritis.